Whenever we are putting together our documentation, this note that I am documenting is something that a payer is going to want to be detailed and is going to want to be indicative of a session that's going to help their person get better. It tells a really good story of what actually happened in the session. It is really helpful, especially with CBT. Being able to see that process really come out in the notes has really been pretty refreshing.
Eleos captures the detail of the session and then it writes it in the form of interventions from me, responses by the client, and it also goes into symptoms, it goes into client diagnoses and prognosis. It will also provide suggestions for what the plans are between now and the next session.
When I take notes, I usually focus on what they are presenting rather than what I'm presenting. So having that little section on the things that I did to help them out was very beneficial for me because then I can express what I did in the notes.
I really like the way that you guys have closed sourced fed your AI with information from clinicians. You're getting that information from a mental health professional that's reviewed a process or a modality.
The quality of my notes has increased significantly. The breadth and depth of the notes have improved. It demonstrates medical necessity, which is of course very important. It gives suggestions for future direction with the client based on the session. So it's kind of like a trainer too.
Being able to get information on their listening ratio and some of their key words and stuff like that, it puts you in a position to where you're able to really learn each time that you use it.
If I were to equate it to a therapeutic model, I am doing those things. My mind just doesn't think about it as I'm doing it. When I saw that and it was like, therapists used emotional regulation technique, I was like, I did that.
Especially if I had a session and then it's like hours later, yeah, that's what I talked about. It creates a lot of sentences and phrases that I don't always think about when I'm writing my note, and actually gives a good idea of like where to go like with the client for like the next session.
When I read through the little comments on the side, I was like, oh wow, yeah, we did talk about that. Instead of thinking about, okay, what did we talk about? I could just read through it okay, yes, I remember that's what we did do.
We've focused in the past very heavily on client speak, but if you focus just on the quotes of the clients, it's more difficult for you to get a viewpoint on what the clinician is doing. I think it's also tough for the clinician to really even be able to say what it is they're doing.
There's been some times where I'm like, oh, that's a really nice way to sum it up. I never would have went there, but like, yeah, let's use that. We did it, so we'll go with it. It's just weird because you don't have to do any editing. And it's like, wow, my notes could actually be like less than a minute.
Eleos has been an invaluable tool to me as a mental health professional.